practicing bariatric surgery for over 25 years, and I want to introduce you to an exciting new procedure that I call the SLIMMS Metabolic Procedure. SLIMS is spelled SLIMMS and stands for Surgically Limit Intake Managed Metabolic Syndrome. My goal with developing this surgery was to offer my patients a better procedure than the gastric sleeve or the gastric bypass alone. The SLIMMS metabolic procedure is a combination of the gastric bypass and the gastric sleeve, and before I explain how the procedure is performed, I think we should review the gastric sleeve and the gastric bypass so we're all on the same page. The gastric sleeve is a one-step procedure that involves cutting the stomach and removing 2/3 of the stomach to leave a narrow stomach that we call a gastric sleeve. The gastric bypass is a two-step procedure and involves cutting the stomach to create a small upper stomach, or what we call a stomach pouch, and then cutting the intestine to reroute food so it bypasses the stomach. The result of both procedures is that the patients get a feeling of fullness with less food and also get a dramatic decrease in the hunger hormone ghrelin. With the gastric sleeve, the patients find that after 1 year, their ability to eat food increases and they don't feel full with smaller amounts of food so much anymore. However, the hunger hormone ghrelin stays low. With the gastric bypass, after 1 year, the hunger hormone ghrelin has increased. However, patients still feel full with much smaller meals. So what I wanted to do with the SLIMMS metabolic procedure was to have something that would result in what I call the power of combined. And what I mean by this is that the patients would get both a permanent decrease in the hunger hormone ghrelin as well as feel full with smaller meals permanently. So to do this, I developed a procedure that's a combination of both the sleeve and the gastric bypass, and involves doing first a gastric sleeve and then cutting the intestine to create a small upper stomach pouch and performing a bypass so that you have the configurations shown in the diagram. The end result is that you have a gastric bypass with the portion of the stomach that produces ghrelin permanently removed. I've been performing this surgery for a couple of years and have had excellent results. And if you'd like to learn more about this procedure, please contact my office for a consultation or visit my website at www.slimsweightloss.com. I hope you found this interesting. It's an exciting new procedure, and I'd love to talk to you about it. Have a great day.